Hello my people, welcome back to my channel, My Health with me Bush. Continue subscribing, liking and sharing our videos as we learn together. So today we're going to talk about ectopic pregnancy. And ectopic pregnancy is simply pregnancy outside the womb or pregnancy outside the uterus. Mostly it happens in the fallopian tube, and that's why it's called tubal pregnancy. Okay? So fallopian tubes are the communicating channels between the ovary and the womb. So once fertilization takes place in the fallopian tube, the fertilized egg implants itself in the fallopian tube and starts growing, leading to ectopic pregnancy. Ectopic pregnancy also occurs in the ovaries and even in the cervix. So what are the risk factors or the causes of this ectopic pregnancy? Number one is what we call prior ectopic pregnancy. If you have had previous ectopic pregnancy, chances are very high that you will have subsequent ectopic pregnancies. Number two is what we call infections. If you have STIs and chronic UTIs, they will lead to inflammation of the fallopian tubes, making it hard for the mature egg to move to the womb, making it to stuck in the fallopian tube, and hence leading to ectopic pregnancy. Some of the infections causing that is gonorrhea and chlamydia. They cause the inflammation of the fallopian tube. Number three is prior tubal surgery. For example, if you had blocked tubes, if they were unblocked through surgery, chances of having ectopic pregnancy, they are very high. Number four is what we call pelvic surgery. If you had abdominal pelvic surgery, they also can lead to that. Next is what we call birth control choice. What you have chosen as your birth control, e.g. IUD and tubal ligation, there are very high chances they can lead to ectopic pregnancy. So we want to see the three cardinal signs of the ectopic pregnancy. Okay, these signs are not so specific to ectopic pregnancy, but they can lead somebody to diagnose as an ectopic pregnancy. So number one is what we call shoulder tip pain. So if you have shoulder pain, one shoulder pain, it might be a sign of an ectopic pregnancy, and that is if you have done a pregnancy test and it is positive. Number two is what we call one-sided abdominal pain, and number three is a positive pregnancy test. Now, what are some of the warning signs and symptoms of an ectopic pregnancy? Now, what can you see in an ectopic pregnancy which raises concern, which needs you to rush to the nearby hospital for care? Number one, that's one if you feel lightheadedness or dizziness, if you see blurred vision. So sometimes those are signs of ruptured ectopic pregnancy. Sometimes when this fertilized egg grows in the fallopian tube, it leads to the rupture of the fallopian tube. And once there is rupture of this fallopian tube, what do you expect? There is an internal bleeding. So once there is an internal bleeding, what do you expect? this person is losing blood, and therefore he will have signs of shock, and these are dizziness, blurred vision, and even profuse sweating. Okay? Another thing is what we call abdominal cramping. This person will have a very severe abdominal cramping. Number 3 is what we call pervaginal bleeding. Sometimes this ectopic pregnancy, somebody can be bleeding internally, but the blood isn't coming out. So whenever you feel lightheadedness, you feel like abdominal cramping, that's also one-sided pain, and you think you're pregnant, you're supposed to rush to the nearby hospital to seek help. Okay? This ectopic pregnancy is a silent killer. It doesn't have specific signs and symptoms. So what I'm gonna advise my people is that whenever you are pregnant, please take your initiative to go for an abdominal ultrasound. The abdominal ultrasound is only key, which will detect where the fertilized egg has implanted. Is it in the right place or is it in the wrong place? Because these all the signs that I've told you, they don't specifically define an ectopic pregnancy. They can define other things. So for us to be very sure, it's good for every individual who is pregnant to always go for a scan, and that is, early pregnancy, between 1 month to the scan always detect pregnancy after 6 weeks. So between 6 weeks to 9 weeks, you can also go for a scan to detect where this fertilized egg has implanted. Thank you for your time. We'll keep learning more, and possibly next time we'll be learning about family planning in details. Thank you. Continue subscribing, liking, and sharing our videos. Goodbye till we meet next time.